This is Dr. Jeff Clauser. This is my video for my Remplissage technique utilizing Q-Fix all suture anchors. This is a 25-year-old male with a history of multiple anterior shoulder dislocations. The patient had a posterior labral tear as well as an anterior labral tear. After the posterior labrum is repaired, I will then prepare the Hill-Sachs lesion with a shaver through the posterior portal. I try to get that down to a healthy bed of bleeding bone for healing purposes. I'll then back out the cannula, which was already in place, just superficial to the infraspinatus tendon and deep to the deltoid fascia. A drill guide is then inserted through the cannula posteriorly. I will then find the inferior portion of the Hill-Sachs deformity with the drill guide. Once I find my location, I'm happy with the placement, I will then insert the drill. I like the Q-Fix anchor for this procedure. The bone in this portion of the humeral head can be soft and the pull-out strength is excellent. In addition, while placing the drill guide, it is easy to find your location and then simply drill through this and hold your location while you're passing your sutures, as opposed to using an awl, which sometimes can be difficult to pass back and forth through the rotator cuff tendon. At this point, the first anchor is in place. I will then pull the drill guide out. The sutures will remain in the cannula, and I'll save those to the side and use those to tie down later on. I will then insert the drill guide once again and then find my location more superiorly in the Hill-Sachs deformity. You may have to bounce around a little bit to make sure that you're in your correct spot, and once you find your spot, you try to hold it. You can see here I had a little bit of difficulty visualizing where that drill guide was, so in order to make sure I'm really putting it exactly where I want to put it, I'll back that out a little bit and use the awl in order to get the drill guide all the way through the tendon, so that way I can really line this up perfectly and see exactly where this is going to sit on that Hill-Sachs footprint. So once I punch it through the rotator cuff tendon, I could then back that out a little bit and see this very clearly. So now you know exactly where this is going to be placed. I will then drill this as in the prior anchor and then place the anchor. This is my preferred technique for the Remplissage in order to fix a large Hill-Sachs deformity. I've used a couple of different techniques. I find this to be the simplest and most efficient way to get this done. I used to go into the subacromial space, find the sutures and tie it down. However, I find that tying it blind and cutting it blind is just as effective and certainly more efficient. So once the anchor is placed, I will then pull the drill guide out. I will then grab one suture from each of the anchors, do a judo chop, and then tie over the top. Once we tie this down over the top, I want to make sure that the knot is quite secure. I'll try to back it out and pull on both limbs to make sure that the suture knot is quite secure. If there's any excess suture, you cut that off. And then here's the payoff where you'll pull on both free ends and watch the infraspinatus dock right into the Hill-Sachs deformity. You can see this fill the deformity quite nicely. I will then tie this down with a surgeon's knot with several half hitches on top to ensure that it is quite secure. And then it's simply just a matter of using a knot cutter to cut this blindly. You feel the knot and then bounce back just a touch and then cut it. That'll allow you to ensure stable fixation of your large Hill-Sachs deformity, which should help prevent against further dislocations.